In this video, we are going to look at factors that can influence how CYP3A enzymes work. We know that CYP3A enzymes help metabolize around half of all prescribed drugs, but their activity doesn't stay the same throughout life. In fact, aging, liver function, a person's sex, and environmental factors can significantly influence how well CYP3A enzymes work. Let's start with aging. As we age, our liver shrinks and hepatic blood flow decreases, sometimes by up to 50%. Since CYP3A enzymes are most active in the liver and intestines, these changes can reduce enzyme availability and slow down drug metabolism. This means drugs that rely on CYP3A4 for breakdown, such as benzodiazepines, calcium channel blockers, or certain statins, may stay in the body longer, increasing the risk of side effects and drug accumulation. In older adults, especially those with multimorbidity and polypharmacy, this reduced metabolism can make them more vulnerable to adverse drug reactions, a key reason to monitor and review medications regularly. It's not just aging that affects liver function. Chronic liver conditions such as cirrhosis will impair CYP3A function, which then reduces metabolism and clearance, increasing the risk of adverse effects. A person's sex can also have an influence on CYP3A activity. People assigned female at birth often have slightly higher CYP3A activity than people assigned male, which means they may break down some medicines a bit faster. The difference is not huge, but it is still important to consider with other factors. Patient factors like age and sex aren't the only factors that influence CYP3A. Let's talk about the environment. Lifestyle habits and what we eat and drink can affect CYP3A activity. One well-known example is grapefruit juice. It contains natural compounds that inhibit CYP3A enzymes in the gut. This can lead to higher than expected drug levels in the bloodstream, which could lead to a significant clinical impact. For example, when felodipine, a blood pressure medication, is taken with grapefruit juice, its bioavailability can more than double, raising the risk of hypotension and side effects, and the effect of grapefruit juice can last up to 72 hours. Other natural compounds, like flavonoids, found in chocolate, tea, coffee, wine, and fruits, may also alter CYP3A expression. Their effects are often subtle, but may still contribute to variability in drug metabolism from one patient to another. Chronic alcohol use, for example, will induce the enzyme, whereas acute consumption will inhibit it. Smoking is another factor. Compounds in cigarette smoke can induce CYP enzymes, although it more strongly affects CYP1A2. In some cases, smokers may metabolize certain CYP3A substrates more quickly than non-smokers. So what's the takeaway? CYP3A activity is not fixed. It changes with factors like age, diet, lifestyle, and other drugs. Understanding these influences can help you make safer prescribing decisions, especially for older adults and those on multiple medicines. In short, metabolism is personal, and CYP3A is part of that story.